First of all,
Perfect. So I'm just going to share my screen and we can get started.
Great. I just first want to say, Sarah, if you can interpret for me, that would be great. I just want to first say thank you so much for the Chicago Movement Coalition, for Dr. Jennifer and her team to be here. We are so honored and excited for today's presentation.
Thank you.
Thank you. Do you want to translate that?
Yeah, Sarah, are you able to?
你们好，他们医生今天说呢，是很感谢我今天帮你们会翻译医院的一些讲解和报告的。
Right. Well, thank you everyone for joining. I'm Dr. Jennifer Drissi. I'm the Movement Disorders Fellow at Northwestern, and today we'll be giving a workshop on Parkinson's disease.
然后呢，今天呢，医生呢，他会跟大家讲解有关这个柏金森的这个病的有关的报告各方面的。
And I'm coming on behalf of the movement, the Chicago Movement Coalition, which we'll go over shortly.
然后呢，他们一会儿呢也会，他们的团队也会介绍有什么任何的报告。
So the outline and things we'll cover today are going over what is the Chicago Movement Coalition, as well as a lot of background and details about Parkinson's disease.
然后呢，他们主要呢就说一下这个芝加哥关于他们部门里面还有这个柏金森就是柏金森的这个病的各方面的讲解。
We'll also be going over different.
Sorry, Doctor. I just want to ask, Sarah, 可不可以用广东话，还是就是说普通话？ Oh, you're on mute. Give me 1 sec. Okay, we can hear you now.
Okay.
We can hear you now, Sarah.
Oh, okay. Do you guys prefer me speak Cantonese or Mandarin? I can speak both.
Alex, 怎么想？大家国语还是广东话？广东话比较好吧，对不对？给我一个 thumbs up， 如果是广东话。
广东话，对，
广东话
比较好一点啊。
OK， 好，谢谢。OK， sorry, Dr. Jennifer, we are just trying to make sure the translation was in Cantonese and
no worries.
Mandarin. Yes. Okay. Thank you.
Is it okay to continue now? Perfect. So in addition to talking about Parkinson's disease, we'll also talk about some resources that are available, research resources, as well as community resources for Parkinson's disease as well.
咁樣咧，咁醫生佢話咧，關於呢個帕金遜症咧，佢會同你講解下佢嘅背景啦，同埋有關帕金遜嘅，同埋佢任何嘅搜索啊，同埋有關嘅資料嘅。
And then, like I said before, I'm coming on behalf of the Chicago Movement Coalition. We're basically a partnership between... Go ahead.
Oh, sorry, excuse me. I saw there's people that saying they do not understand Cantonese.
Okay. Amber, do you have a... Should we do... I can shorten it more and do...
So what we can do, so for today, we will do Cantonese, and then this recording. So there, I don't know, Alex, what do you think?
What I could also do, it would just take down some of the information that I would be able to talk through. But I don't know if it will take longer to say both. We'll probably double the time than Cantonese and Mandarin.
Yes, so Alex is our in-home coordinator, and a lot of the participants here today are under his management. So let's proceed with Cantonese, because I know that a lot of the participants are Cantonese speakers. And we also, and then we may be able to provide a Mandarin training based on this recording, because we also have an in-house geriatric workforce specialist, Melody Dong, and she is the one that usually does the Mandarin all-staff training. So today, let's just go ahead and go with Cantonese, and then we will internally provide Mandarin training.
他们说呢，I'm going to translate in both Cantonese and Mandarin first to let them know. 他们说呢，今天呢，因为他本来这个活动他是说只是先用粤语的，然后之后呢，他们还会再组织一次是说国语这样，但是我会跟他们说，如果国语你们如果可以的话，再发一条短信给他们吧，看看广东话好一点还是普通话，因为他们可能这一次的话翻译是不够时间的，如果只是两种语言的话。I explained to them like because you guys will not enough the time, so only can like I can only speak like Cantonese or Mandarin. So, but I do see a lot of people that they write up like a lot of people they do not understand Cantonese. So the people they make a comment.
Should I continue or? I think you're muted, Amber.
Yeah, so let's continue with 国语, and then I will reach out to Alex and see.
Okay. All right. So we started the Chicago Movement Coalition in 2019 in order to really spread information, so knowledge and resources about Parkinson's disease to underrepresented areas of Chicago.
然后呢，他们呢，这个部门呢是sorry, do you mind to write it down one more time? What year do you guys started with the
2019?
他们1919年呢就开始了有这个机构，然后呢，主要的基本的部门呢是在芝加哥的，然后他们是专门研究那个柏金逊的这个病的。
The leaders of the Chicago Movement Coalition, we always say, are people from the communities. So people living there in these communities who are living with PD, as well as their families and leaders in the community.
然后呢，大部分团队他们人员都是住在芝加哥的，然后还有他们的医生啊，还有他们的团队的，还有很多参加这个活动的人都是居住在芝加哥里面的。
And we actually have one of our CMC leaders here with us today, who's going to give us his input about being a care partner of someone with or living with Parkinson's disease.
然后呢，他们今天团队其中一个人员呢，其实他生活里面有个家人也是就是他有跟一个柏金逊这个病的人一起有工作的。
So the first thing to know is that Parkinson's disease is very common. So it affects almost 1 million people living in the US as of 2020.
然后呢，在2020年的话呢，就是单是美国来说，有柏金逊这个病呢是已经很常见的一个病。然后单是美国已经有1万这么多的病人了。
And so it's the second most common neurodegenerative condition, only secondary to Alzheimer's disease.
然后呢，在2019年的话，它只是单的超过了这个就是海默茨症的病人。
And again, just emphasizing that it's very common, 1 to 2 out of every 100 people over the age of 60 actually have Parkinson's disease in the US.
然后呢，以美国来说的话呢，是1%到2%的人呢，过了60岁之后呢，都是有这个柏金森病的。
And more than 10 million people worldwide.
然后呢，全世界的话呢，是比这个6万人要更多，就是有6万个人是有这个病的。
Many people actually go underdiagnosed, especially people from minority groups, such as African Americans, Hispanic Latinos, as well as Asian communities.
但是呢，当然还是有一些人员呢，有些人呢，他们是没有去发现这个疾病，例如说亚洲人啊，或者说亚裔啊，西班牙裔啊，或者说非洲裔的话呢，也是有很多人是没有发现这个病或者去治疗的。
And that's one of the main reasons why we started the CMC, to really get the word out about Parkinson's disease.
所以呢，我们才会组织这个机构来去更加的研究有关柏金逊的症状，还有任何的多出来的资料。
So what do we know about the patterns in Parkinson's disease? We do know that it's more common in men than women, although women are also usually underdiagnosed compared to men.
然后呢，我们发现呢，关于柏金逊这个病呢，男人会是比女人要多的这个病，然后当然也是会有某部分的女性呢我们是没有发现，或者说她们可能有了这个病，但是我们是没有发现的。
And then we do know in 1 out of every 10 people with Parkinson's disease, we know that there's a specific genetic mutation or family influence that increases their chance of the disease. And other people, we're not too sure.
然后呢，当然也有部分的人呢，就是10个人里面有1个人呢，是因为家里面的那个可能是先天性或基因问题，然后也是会有遗传性，然后得到柏金逊这个病的。但是原因是什么呢？我们到现在还不知道。
And so in this other group, it's likely a combination of genetic factors that we're still learning, as well as environmental factors.
所以呢，我们现在还在研究，可能是因为先天性的遗传，但是可能也是就是一般的人有可能也会因为哪怕不是说遗传性的，也会得这个病。
So there's multiple symptoms and signs of Parkinson's disease that we'll go over, but we're going to talk about 3 main ones.
然后呢，当然很多原因也会导致有这个病，但是我们主要是说一下3个有关这个柏金逊病的那个主要的条件，会引发什么事情。
One of the main symptoms that has to be there is slowness. And so it's a slowness of walking, slowness of movements, and movements get smaller over time.
然后呢，最主要的其中一个病症呢，就是慢慢的动作变得慢，就说可能走路变慢啊，反应变慢啊，说就是那个人平时的动作就会所有的反应啊都会变慢。
There's also a stiffness or tightness of muscles.
或者呢，另外第2个症状呢，就是他的肌肉呢会比以前更加的紧了，或者说肌肉啊、骨络各方面会比以前要紧很多。
And then some people, but not all people with Parkinson's disease, will have a tremor or shakiness, sometimes of their hands, other times of their legs or chin.
然后第3个比较重要的症状就是他们会有点抖动，以前是没有的，但是如果得了这个病之后呢，他们手或者脚呢都会开始有一些小的抖动。
And the specific tremor in Parkinson's disease is actually worse when people aren't using their hands. So when it's sitting there, when they're watching TV or when they're walking, their hands can shake, as opposed to when they're using their hands, the tremor actually gets a little bit better.
然后呢，最主要关于那个手脚抖动的话呢，最主要是当他们不再用手的时候呢，反而那个手会抖得更厉害。就是说，如果他们在吃饭或者在用那个手的时候呢，反而不会那么抖动。但是他们单单坐在那里看电视啊，不用的时候呢，手会更加的抖动。
Symptoms in Parkinson's disease usually start on one side of the body and then usually makes it to the other side as well. But symptoms are usually always worse on one side than the other.
然后呢，他们其中的一个病症呢，主要是引发的是是从一边身体开始的，大部分都是一边的身体会比较明显有这个症状。
And the main thing to remember is that everybody's Parkinson's disease looks a little bit different as far as the severity and the types of symptoms.
当然，每个人呢，他们就是得了柏金逊这个病的话呢，不一定说每一个人的症状都是一样的，而且他们的症状的那个反应呢，也会有不一样的。就是有一个人的症状可能比另外一个人的症状更加的明显。
In addition to the initial symptoms that I described, people with Parkinson's disease also have a quiet voice, a soft voice. Often people ask them to speak up.
然后呢，还有其他的那个症状呢，就我们现在要说一下，就是可能他们会说话会比平时要小声一点，所以很多时候你会听不清楚他说什么。
They can also have less expressions on their face. Sometimes swing one arm less than the other due to the stiffness that we were talking about, and can also feel off balance and sometimes have falls when they've had Parkinson's disease for a while.
然后呢，也有可能他们的面部表情呢不是那么的明显，或者说当他们甩手的时候呢，一边的手没有另外一边手那么大的明显的那个动作，所以这个也是因为根据他其中一个很明显的那个他们那个就是症状，就是他的肌肉会很紧，所以有时候呢得了柏金逊病的人呢，他们很容易摔倒。
One of the main things to know is that the symptoms in Parkinson's disease change slowly or progress slowly over time.
但是呢，我们很明显知道的就是柏金逊病人呢，他们这个症状呢是慢慢的发生，然后那个症状会越来越明显，但是他那个发病就是很慢的一个时间。
And while people often associate the physical symptoms of Parkinson's disease with the disease, there are multiple non-physical symptoms that also accompany Parkinson's disease.
当然呢，得了柏金逊病这个的那些病人呢，他还会有其他的那些症状，有时候可能说其他的病也会引发起来的。
Some examples include a loss of smell that sometimes can happen even before the motor symptoms start, constipation, mood symptoms like anxiety and depression or fatigue.
然后呢，也有一些症状，这一些病呢，是你发现他得了柏病之前就会有引发的了，也会发生。就例如说，他们就是开始闻不到东西，闻不到味道，然后也会有焦虑症啊，或者说他们很容易觉得累。
So it's important for us to not only treat the physical symptoms, but also the non-physical symptoms like the mood symptoms, sleep problems. Sometimes people have low blood pressure.
然后呢，除了我们要针对去治疗他们的主要这些实际上的症状，但是他们还会有别的症状的，例如说他们晚上会失眠啊，或者说高血压，这些他们同时也是要去治疗的。
So what is Parkinson's disease? Parkinson's disease is caused by the breakdown of brain cells that make a chemical called dopamine that's responsible for motor symptoms or movements.
然后呢，什么是柏金逊病呢？它主要就是你的脑部里面的一个基本的元素，然后缺少了，然后它们就导致没有这个产生的元素就不见了。
And like I said, research is really trying to figure out more about and learn more about the causes of Parkinson's disease, but we know that it's a combination of things from the environment as well as genetic causes.
然后呢，我们也知道，像我们说过研究关于这个病情，除了说先天性的遗传，但是呢，基本上像社会也是会有些不是先天性遗传的导致有这个病的人的。
So how is Parkinson's disease diagnosed? So it's what we call a clinical diagnosis, which means that you put together the clinical history as well as the exam, and then the diagnosis is made.
然后呢，我们是怎样发现柏金逊病这个病情那个人会有这个病呢？就是除了看他们家人有没有这个病例，有没有这个柏金逊病的病史，然后第二呢，通过检查，然后检验出来的。
And the diagnosis is usually made by a neurologist. And more specifically, there's a movement disorder specialist, is actually a specialized neurologist that helps treat Parkinson's disease.
然后呢，他们是分开两个部门，一个呢就是神经病科的那个医生专科，还有他们一个是专门是研究你们的身体的移动啊，然后他们也这个还有他们这个部门呢也是专门研究神经科的，所以他们会结合这两样东西呢，然后去检验病人有没有得柏金逊病。
There's not a specific blood test or any other test that can give the diagnosis of Parkinson's disease alone, but sometimes we use this scan called a DAT scan that you can see on the slide here to help us. And more.
虽然呢，现在还没有任何的血液可以直接检查出来病人有没有柏金逊病，但是呢，他们会有用一种扫描，就是像图片上面你们看得到的，这个扫描呢就可以扫描到部分脑部里面的有没有这个症状。
We use this scan usually when the diagnosis is more borderline and we're trying to figure out if it's indeed Parkinson's disease.
然后呢，通常呢这个是进一步的检查才会做这个扫描的，才去确认有没有这个柏金逊病。
Like I said, the specific neurologists that treat Parkinson's disease are movement disorder specialists, and they're often at movement disorder centers, or at least some of them, that include not only movement disorders neurologists, but also social workers, physical therapists, occupational therapists, etc.
然后呢，研究这个柏金逊病的呢，不单单是神经病科的专科，他们还有一个是身体移动的，还有说就是那个物理治疗部，还有那个社工，然后加上还有那个局部性的那个物理治疗，他们都会一起去研究的，然后一起去参考，然后结合他们的经验，然后去确诊这个病。
And the reason why I really love Parkinson's disease is that it's a very treatable disease. We have lots of options that we can use to make people function better in the world.
然后呢，他很喜爱参与这个活动，关于柏金逊病的这个活动，因为他知道柏金逊病呢它是一个可以治疗的一个病来的，然后他们可以根据他们的治疗，然后把病人结合就把病人可以治好。
And we use a combination of medications, exercise, nutrition, as well as various therapy services to do so.
然后呢，他们可以通过药物治疗，然后通过那个社工，通过他们的物理治疗，然后把这个病情治疗更好。
So we talked about therapy services a bit already, but there's a combination of physical therapy, occupational therapy, and speech therapy, which all address specific symptoms, symptoms of Parkinson's disease.
像我们说过呢，他们有很多不一样的治疗方法，然后它除了物理治疗、局部性治疗，还有 语言上治疗的话呢，他们都是根据病人的情况，然后他们去针对性的治疗的。
In addition to the physical symptoms that the physical and occupational therapists can help with, the speech therapists also help with speech volume, communication, as well as swallowing.
然后呢，像平时物理治疗，但是像说那个语言治疗呢，他们是针对性治疗，帮病人说吞咽啊、说话语言上的障碍呢，他们是很针对性的治疗的。
While we have multiple medications to actually treat the symptoms of Parkinson's disease, we don't yet have a cure, something to slow down the course of the disease as far as medications, although we're working on that with research.
然后呢，现在虽然他们没有说，他们在用药物治疗，但是呢，药物治疗还没有说可以完全单靠药物就可以把这个病治好的。当然，他们还在研究上面。
What we do know is that exercise, to some extent, actually can slow down the progression of symptoms.
但是呢，他们发现呢，运动的话呢，是可以把这个病情延迟，或者说减低这个病情的那个并发的。
So regardless of what medications or if people are on medications for their Parkinson's disease, we always recommend regular exercise, which includes a combination of aerobic exercise, strength training, and balance.
然后呢，无论病人是已经在哪个程度的那个在病情的什么程度呢，他都是很建议做运动的。然后他们根据不同的运动呢，他们可以帮病人延慢这个病情。
So as we've discussed, Parkinson's treatment is more than just medications. There are medications, but there's also exercise, therapies, there's support groups, healthy diet, as well as sometimes research participation can all be part of the Parkinson's disease plan.
然后像我们说了，不单单只是说药物治疗，他们的物理治疗，然后说话语言上治疗，然后他们的营养各方面的分配，然后运动，这些都是可以帮助到这个病的。
And I'll shift this over to Karen Williams, our senior research manager at Northwestern, to talk about research.
然后呢，我们现在呢转换到我们的团队的另外一个我们的团队的医生，然后呢，他也是主要是研究柏金逊这个病的。
I think you're muted, Karen. Amber, can you unmute Karen, please? There you go, Karen.
All right. Hello, everyone, and thank you all again for joining us on this call. We greatly appreciate it.
谢谢大家今天参与我们这个团队的一个这个就是这个发表的活动。
I'm Karen Williams, and one of the research managers at Northwestern, and I'll talk to you about some of our research programs that we are conducting.
然后呢，我是西北大学医学学校的这个医院的那个专门是研究这个病的一个经理的。然后我今天呢会跟大家说一下有关这个病，然后还有我们的搜索啊各方面的查询到一些什么。
So participating in clinical research gives us a better understanding of Parkinson's disease. It finds ways to slow down and hopefully eventually cure the disease.
然后呢，我们已经我们现在研究到呢，就是通过某部分的治疗呢，可以延迟这个病症发炎。然后呢，还有。
We're looking at developing, improving PD treatments for symptoms, improving the quality of life for people with Parkinson's disease and their care partners and their families. We know that PD not only affects the person with PD, it affects their family as well.
然后呢，我们会找方法去延迟这个症。然后呢，当然有柏金逊病的病人呢，不单单他们会有他们身体上的不舒服，然后我们也会想，除了治疗这个病，还有帮助病人还有他们的家人。
And so we're finding ways to partner with communities such as yourself to spread the information about Parkinson's disease, what resources are available for patients or participants to be involved in clinical research.
然后呢，我们呢主要是研究还有散布，看怎样可以把这个病情治疗得更好，然后把这些我们有找到好的条件都分享给大家的。
There are different types of research studies. Observational studies, meaning we're just maybe just asking you questions, take your blood, but you get no investigational treatment. No therapy is given at all. Just questions are asked, you fill out forms, and blood is taken.
然后第一样呢，就是通过就是抽取的血液的样本，然后通过我们的对话。然后跟病人的对话，然后调查问卷，这样是开始研究这个病。
Okay. And then there are studies where there are drugs given, so those are called investigational drugs.
然后呢，第二步呢，就是通过药物，然后去看一下对这个药物病人会不会有好转。
So the benefits and risk of participating in a clinical research study, I'll first talk about the benefits. The benefits are you're making a difference. You are making a difference when you're participating. And then you have access to Parkinson's experts. The doctors that see you are experts in Parkinson's disease. And then you have potential access to the state-of-the-art treatment.
Excuse me, do you mind to shorten of the sentence?
Oh, okay. You can just read that what's there. Yeah.
yeah. Sorry about that.
You can just
That's
read
okay.
the benefits on this.
Yeah, just read the benefits.
OK， 他们主要的那个福利呢，就是有什么好处呢？就是让病人会感觉到，或者是他们觉得不一样，是他们然后呢，还有他们会跟那个柏金逊就是柏金逊病人就是那个医生啊，或者他们团队专门治疗这个病的人，然后去分享或者研究有什么更好的方法，这样。
And the risks are adverse events and a data breach of your information.
然后呢，当然他们是有风险的，因为他们其中还是要分享他们的资料，然后他们还是需要通过时间，然后去进一步的研究。
Okay, next slide. So you choose the right study for you. You will ask the investigator or the doctor, what will make me eligible to do the study?
当然你是要跟医生还有跟有关的团队人员去说哪一部分或者什么研究您是可以进一步去参与的。
Where would the study be conducted?
然后这个学习呢是在哪里你可以参加，然后他也会你可以找到那个相关的地点。
And how will this impact my care? So you want to know what the care implications are.
然后当然你还一定要去看主要是治疗什么或针对什么去治疗的。
Okay, I want to talk about three important studies at Northwestern.
然后呢，我想说一下呢，西北大学研究了他们有3大部分，主要研究了什么。
The three studies are the observational studies where you would come in, give blood, and complete questionnaires.
然后呢，第一个呢就是去西北大学，就是在那里抽取血液的样本。然后呢，第二呢就是把那个调查问卷交上，然后去进一步的研究。
Okay, the Northwestern's biorepository study is a study for Parkinson's patients or any patient with a neurological disease and for people who do not have Parkinson's. So we're looking for healthy controls.
然后呢，他们说这个西北大学研究的这个项目呢，不单单针对柏金逊病的病人，它还会针对说有这个也是有神经科上的有关的病人，或者说没有没有这个病的，但是呢，他们也是想要进一步做一个研究，这样那些病人都是可以这个他们的团队是正在学习这个的，研究这个的。
The second study, the PPMI study sponsored by the Michael J. Fox Foundation, is a similar study. So that is also for Parkinson's patients and patients that are healthy that do not have Parkinson's disease, what we call healthy controls.
然后呢，第二个他们的那个团队呢，就是也是治疗或去学习有关柏金逊病人的，或者说哪怕是健康的人，他们只是想要去学习有关柏金逊病的，他们都是会参加的。
Okay, the PD generation study, this is a very important study. If you have Parkinson's disease, we are doing genetic testing. You can come to Northwestern, we will put you in the study, and all of these study procedures are free. There is no cost.
然后呢，第三个呢是叫做 PD study， 然后他们这个呢是很重要的，因为这个呢是会调查，然后看病人有没有那个先天性遗传的这个柏金逊病的，然后这个治疗还有他们研究呢，这个都是不用钱的。
So as we said, the key points are there's a lot of research going on. We want all underrepresented groups to participate in clinical research. And there are 2 websites for further information about clinical trials.
然后呢，他们这下面呢有2个网站，然后呢，它这2个网站里面呢都会告诉你有关，如果你想知道更多他们这个团队还有他们这个学习的那个资料呢，你们可以进去看一下。
Okay. If anyone is interested in participating in the PD generation, where genetic testing, you will have our information. You can contact me and we will get you into the clinic.
然后呢，如果你们任何一个人呢，会对刚刚第3个那个团队 PD 研究呢，你们有感到兴趣的话，你们可以联系这个医生，他这个经理，你们有他的联系方式，然后他会帮你填写，然后注册的。
All right, thank you so much, Karen. So us as the CMC, we want to make sure that the resources that are available are you all are aware of. That includes research, that includes, knowing where the movement disorder specialists are, as well as different things that are going on in the community.
然后呢，他说呢，这个除了研究，然后他们也会除了先天性的遗传，然后他们也会根据平时他们研究说社会上哪些人接近这个病的，他们都可以调节得到。
And providing support for families and caregivers is part of that.
然后呢，也会帮助家人或者需要跟这个病人有联系的帮助的他们的人。
There are movement disorder specialists or Parkinson's disease specialists at multiple centers in Chicago, all listed here: Northwestern, Rush, University of Illinois at Chicago, the Jesse Brown VA, as well as the University of Chicago.
然后呢，这是以下的 5个地方呢，都是说在哪里可以找得到，或者说他们有那个柏金逊病的专家在那儿的。
One of the reasons why we really are fortunate to talk to you all is that you can help spread information not only about Parkinson's disease, but some of the resources that we have available, including Parkinson's 101 educational sessions, art therapy, music therapy, exercise classes, support groups, etc. And you can email our social worker with her email address there or call if you're interested or you know someone who would be interested.
然后呢，为什么我们不单单想你们知道有关柏金逊的研究，然后或学习，然后以下呢，他们是在他们西北大学呢，他们还有其他的课程，你们可以去学习。然后你如果有任何的你们想要注册啊或登记呢，都可以联系他那个社工的。
There's other organizations such as Rocksteady Boxing and Hubbard Street Dance who also provide classes in the community that are specifically for Parkinson's disease.
当然呢，还有其他团队呢，他们也是可以你们也如果有兴趣的话呢，也是可以参加他们的课程，然后他们也是专门去研究柏金逊病的。
I kind of skipped over a few slides to make sure that we have time to talk to our CMC later, Jose Gutierrez. But more of our information is on our website, the chicagomovementcoalition.org. And then there's a number there if you have further questions about things that we covered today or any of the research projects that Karen Williams went over. Our number is there.
然后呢，你们可以截图。如果呢，像刚刚如果有任何的根据，就是你们不是很清楚，或者说对这个课堂有问题的，你可以直接去他们这个网站，然后呢，也可以联系那个电话的。
All right. So now, without further ado, we're fortunate to have one of our CMC leaders who is living and thriving with Parkinson's disease, Jose Gutierrez, to tell us a little bit about his experience.
然后呢，
unmute Jose. Perfect. Thank you.
然后这个呢是他们的领队，然后也是他们主要是研究柏金逊病的一个领队，然后他会跟您说更多有关柏金逊病的。
Hello.
大家好。
My name is Jose Gutierrez. I'm living with Parkinson since 2017.
然后呢，他这个领队呢，其实他也是从2017年呢，他也是有柏金逊病了。
The way that I find that I have Parkinson's disease is because I was starting having tremors on my hands.
然后呢，刚开始的话呢，我是怎样发现我有柏金逊病呢？是因为我也感觉到我的肌肉是很紧的，然后开始的手也会抖动。
Then I went to see a doctor, and he told me that I have Parkinson.
然后呢，他去见那个神经科的专科，然后就是柏金逊病的专科医生，然后他们发现了我有那个柏金逊病。
Currently, I see a doctor in Northwestern, and until this moment, I've been feeling good.
然后呢，我一直呢都是去找西北大学的那个专科医生，然后接受治疗，然后我现在一直都活得很好。
I've been treating with medicine, oral medicine, and so far, nobody knows that I have Parkinson.
然后呢
I'm sorry.
No, thank you. 我一直呢都是接受那个药物治疗，然后是口服的药物治疗，然后一直这个我觉得一直那个治疗都是很好，没有人会发现我有那个柏金逊病。
And it's very important to have a doctor who is a specialist in movement disorders.
然后呢是非常重要，那个专科医生呢不单单是铂金逊的专科医生，然后他们也会知道有关身体的运动啊或运作的方面的专科。
I'm 65 years old and I'm still working, and I do my job the best I can with my sickness.
然后虽然我有了铂金逊病，我已经65岁了，但是我还是一样的正常工作，然后还是活得很好的。
I receive also physical therapy, speech therapy, and occupational therapies. And
然后呢，Thank you。然后呢，除了那个药物治疗呢，我还在做还接受了那个语言治疗、语言方面治疗，然后物理治疗，还有局部性治疗，然后都过得很好。
I do my best at work and to keep going with my life and my family. And I try to enjoy the most of the days with my family.
我尽量，我一直都把我的工作做得很好，然后除了工作之外，我也是跟我每一天都在很认真，然后就是享受跟我家人一起生活过的日子，然后我也在享受我的生活。
And I'm very happy with this programs that the Northwestern is having to reach out to the communities.
然后呢，我很感谢，我也很庆幸我跟西北大学有这个，就参与了他们的治疗，然后他们还有参与了他们这个活动的那个他们的那个活动，对。
In my community, the Hispanic community, is kind of shy and they do not like to ask questions. And like, if you start having problems with the Parkinson that you not even know about.
然后呢，像我平时生活在西班牙语言的我们的这个社区的话呢，大家都是很害羞的，大家不是很愿意或者说很主动去发表自己的想法或自己的生活，所以呢，哪怕有人得了铂金逊病的话呢，他们是肯定不会说的。
That's the reason I joined these programs that they have in Northwestern to reach out and like my community can and explain them what's going on with this disease.
所以呢，我参加了西北大学的他们这个活动，他们这个机构呢，让我更加的大胆，然后我也可以散布给我的西班牙的社区，让大家更加清楚这个病，明白这个病。
Thank you so much, Jose, for sharing.
Not a problem.
谢谢 ，Thank you.
We always say that we can give you the information from the neurologist standpoint, but the real experts on Parkinson's disease and living and thriving with it is people who are indeed in the community living with it. So thank you.
我们经常都说呢，哪怕是铂金逊病的研究的专科医生，但是他们是很清楚这个病的，但是他们还是铂金逊病人是更加清楚这个病的。
All right, so now we want to open up the forum for any questions that any of you might have. You can either put it inside of the chat, might be the easiest there, or I guess Amber, you can unmute if that's an option as well.
Yes. Go ahead.
Yeah, please. 然后呢，现在呢，大家有任何问题呢，你们都可以发表，在这个短信，你们可以发短信上来，然后有什么问题都可以提问的。
So we already have one question in the chat box. I will go ahead and just say it in English. So the first question is it easier to get Parkinson's after a stroke or like a paralyzing event on one side? what is the probability?
然
Let's
后
do
呢，
that
我
part first.
然后呢，我们刚刚已经看到你们有其中一员发言了，就说通常呢得柏金逊病的病人呢，他们是一边中风了，然后会的是就中风或一边瘫痪是更容易得到柏金逊病吗？几率大概是多少？他们现在呢会回答这个问题的。
That's an excellent question and something that we didn't get too far into during the presentation. But in addition to Parkinson's disease, there are some things that can mimic and look like Parkinson's disease that are actually separate, sometimes strokes in certain areas of the brain.
然后呢，他们说呢，有些病呢，看上去他们的病症是非常相似的，跟柏金逊病，但是他们其实呢是完全不一样，或者说那个病是不一样的。就是说像中风啊这些呢是脑部引发的，然后但是跟柏金逊病又是不一样的。
So people who have a stroke in certain areas can actually have similar symptoms. However, Parkinson's disease is something that's separate. The certain dopamine cells actually die faster than they're supposed to, even outside of a stroke.
然后呢，像中风的病人的话呢，他们可能说那个症状跟柏金逊病很相似，但是呢，跟柏金逊病是不一样的。柏金逊病的话呢，是其中的一些细胞，然后他们是死亡了，然后呢就不会再生了，所以才会导致身体的引发身体的问题。
So while certain strokes can look similar to Parkinson's disease, they don't actually cause Parkinson's disease or increase your risk of Parkinson's disease.
虽然呢说中风他们有些症状是跟柏金逊病很相似的，但是呢哪怕说有病人中风了，或者说有这些症状的话呢，但是他也不会说提高了他得柏金逊病的这个几率，也不会说引发这个病的。
Any other questions?
Yes. So with that, if this is your area of expertise, what is the latest medical treatment for stroke and paralysis on one side?
So
然后呢，sorry, let me repeat the question one more time. 还有了，另外就是第二个问题，就是说中风呢，一边身的瘫痪呢，然后有什么最新的医疗方法这些，然后他们现在会回答这个问题的。
So I do want to make sure that I'm making the distinction between stroke treatment and management as well, and then Parkinson's disease management is separate.
然后呢，第一，我想很清楚的说，中风跟柏金逊病呢，这两个治疗的方法是不一样的，他们是两件事来的。
So for strokes, which is separate, the treatment really is one, preventing a second stroke or another stroke. Sometimes that means aspirin, sometimes that means cholesterol medications, as well as physical therapy and occupational therapy.
然后呢，如果说像中风的治疗呢，除了说止痛啊，他们也会有那个药物治疗，还有说物理治疗，局部性治疗，或者说哪怕说语言上的治疗也会有的。但是这个治疗是治疗好，不会预防第二次中风、第三次中风这样。
For Parkinson's disease, where the dopamine brain cells die quicker than they're supposed to, we use medications that actually increase dopamine levels in the brain.
然后呢，但是柏金逊病呢，就是因为脑部的其中一个细胞，它们是很容易坏死的，然后他们就通过药物治疗去让延慢它那个细胞坏死的那个情况。
And there's multiple medications that can do that. The main one that we use, or the most common one, is something called Sinemet or carbidopa levodopa, which is a form of dopamine.
然后呢，他们呢现在有几种药物呢，都是去治疗，就是针对脖颈逊病的延迟他们那个细胞去坏死的那个治疗。
There's some more questions.
Okay, yes. So the next question is, any involuntary movements in the eyelids or the mouth, I think they're commonly known that like kind of tics, are those symptoms of Parkinson's, including maybe the shaking of the hand?
Yeah, that's a really good question. Oh, sorry, I'll let you.
No, that's fine.
Good question.
You can continue.
I can translate the question.
OK， 然后呢，他们现在有第二个问题，就是说，眼部啊、嘴巴，然后他们会不会说，因为就是中风，或者说脸部、眼部、嘴部这些呢，都是跟脖颈逊病的那个症状是一样的。
So without treatment, people with Parkinson's disease actually don't move their face as much as other people do. But there's an exception, which I'll talk about.
然后呢，像很多就是有很多脖颈逊病的病人的话呢，他们的脸部的那个变化呢，就会比正常人要少。就是说他们的表情啊，或者说脸部表情啊，那些会比正常人要少。然后呢，但是也会有不一样的情况。现在医生就会说一下。
However, people who have Parkinson's disease and who have had it for a while and are on dopamine replacement or medications to increase the level of dopamine can sometimes have extra movements or fidgety movements in their face, in their arms, and their legs.
然后呢，像这个不一样的情况就是，当病人已经吃了那个脖颈逊的治疗药之后呢，他们有些病人呢身体会有比正常人的更多的那个面部啊表情，或者说身体的那个动作会比正常人要多。
And these are bigger movements, bigger than the usual tremor of Parkinson's disease. And it's something that we call Dyskinesias.
然后呢，他们说呢，通过药物之后，这些病人呢，他们的动作会比正常人要大，也会比一般的脖颈逊病人就是抖动那个情况要更加的明显，或者动作会更加的大。
And that's because people who have had Parkinson's disease for a while, who are on these dopamine medications, it's harder for them to stay in the sweet spot of moving okay, not too stiff, not too much movement, but that sweet spot. So sometimes they actually get too much movement, and that's what we call dyskinesia, and probably what you're describing.
然后呢，就是像你们刚刚说的那个症状呢，也是因为他们吃那个药叫 dopamine 那个主要的那个治疗药呢，他们很难去到那个正确的那个，就去到那个正常的那个怎么说呢？正常的那个位置，所以有时候他们不是说动得很多，但是如果过了那个度呢，他们又会动得很多，就动作会变得很大，就很难去到那个程度，就是正常的程度。
And this is due to changes in the dopamine receptors in the brain over time in Parkinson's disease.
对，因为如果特别是病人得了那个脖颈逊病已经很长久的时间，有很长的时间呢，他们这些反应就会更大。
Okay, so in lieu of time, this will be our last question. So in the chat, we have like at what age is Parkinson's commonly diagnosed? And also, what are some preventative measures for this disease?
然后呢，这个是一个最后问题了啊。他们就说脖颈逊病通常是什么年龄会很容易得到这个病，或者说有什么好的治疗的方法，或者说时间。
So Parkinson's disease is more common in people who are over the age of 60. However, there are what we call younger onset Parkinson's disease as young as the 30s to the 50s that sometimes happens.
然后呢，通常呢，像我们研究、我们学习，觉得大部分并发的脖颈逊病人呢，都是60岁以后的，但是也是有部分的病人，他们是从35岁到50岁左右这个年龄段的。
And so Parkinson's disease Unfortunately, it's hard to totally prevent. However, you can delay some of the symptoms by being active and doing regular exercise.
然后呢，虽然现在还没有研究说可以完全去预防这个病，但是呢，我们现在研究就是通过运动啊，或者说去多运动，然后多去针对就是个人的生活个人的身体情况呢，是可以延迟这个并发的时间的。
So research right now is trying to figure out ways to slow down the progression of the disease, but there are patients who come in who have been very active and exercise a lot and actually had their symptoms come years later than they probably would have otherwise.
然后呢，像我们也会看到有些病人呢，他们是已经有铂金逊病了，但是因为他们是经常运动的、经常锻炼的病人，所以呢，他们那些就是那些症状呢，其实是过了很多年之后才会开始有这些症状。
Okay, thank you so much, Dr. Jennifer, and thank you so much for the Chicago Movement Coalition as well as Northwestern for this wonderful presentation. Oh,
谢谢医生，
Karen?
还有谢谢谢谢
go
我
ahead.
大学的各方面，对。
Karen has a comment. Are you able to unmute now?
Just one more point I want to make, I inadvertently forgot. We do have another clinical research manager who is of Asian descent. If you have any questions regarding any of the research activities or studies, feel free to call us. She will talk to you. You won't need a translator. She will talk to you and give you all of the information that you will need.
然后呢，他们团队呢还有另外一个医生呢，如果
Thank you.
你们Thank you。如果他们有任何的，你们如果有任何的问题，还有想要进一步知道的多一点资料的话呢，你们都可以联系他们，然后那个医生呢会跟你们讲解的更加多的。
Thank you so much. So this part of the presentation ends here, but for the rest of the night, they will be attending another 2-hour training. So thank you so much again, Dr. Jennifer and Karen and Jose, and also Sarah. Thank you so much for translating.
然后谢谢大家，然后现在这个今天的说话已经到此为止了啊，然后他们晚一些呢还有2个小时的另外一个报告。
Thank you so much for having us. We really appreciate it. And thank you, Emily Zivin is also with the CMC.
Oh, yes.
Who helped to coordinate this as well. So thanks so much, everyone. Enjoy the rest of your
Thank
session.
you. Good night.
Bye.